like anything humans create, healthcare has changed a lot over the centuries. A few hundred years ago, most doctors were doing things like, maybe using herbs and stuff to take care of symptoms. They were bloodletting. Letting out blood was seen to be a way to let out disease and disorder from the body. And so people were losing lots and lots of blood in order to get well. They would use things like leeches, which can be still used today. They actually are quite good for sucking out the blood from bruises and such things. They would use them for many, many things. Maggots were used to take care of rotting flesh. Still effective, but a little on the gross side. And so healthcare has evolved a lot over the years. It's gotten, it's gone from herbs and remedies that you could really have on hand to things like surgeries and anesthesia. There didn't used to be anesthesia. It's a big change, and it's really driven how healthcare is approached. We've moved more on to synthetic medicines and surgeries and stuff like that. And medicine used to be grown in the garden, and many of the synthetic medicines that we have today are still based on those plant compounds. But it's hard to patent something that you grow in your garden, and so that it's hard to make money on it. So as healthcare has evolved, it's gotten more and more driven by money and by being able to make money off of people's sickness. And as that has happened, it's become less and less about getting people well and more about keeping them sick so more money can be made off of them. And that focus from, health being based on what you eat and how you act and, using some medicines from your garden has shifted to how can we medicate you to stay alive as long as possible, but not ever really feel good so that we can keep treating you. And so it's really made us reliant on doctors and hospitals and medicine, but nobody's getting healthier. And I think we're getting to a tipping point where people really want to get healthier and they want to take care of their health. And they're recognizing that all of the medicines aren't helping them get healthier. They're really making them feel worse in the long run, and that's not sustainable. So I really see the future of medicine moving out of the doctor's hands and the hospital's hands. I see the future of medicine moving back into the hands of the people who are working to stay well. And they're doing it with the help of coaches and wise people who know how health works and how medicines work, and who can help them build their health. Not people who are there, when you get a symptom and you want to fix it. That tends to be how our medical system works now. You just live your life however you feel like it until you get symptoms that are feeling nasty, and then you go to your doctor and get a medicine to fix it. And often that medicine, it might help with the symptom in the moment, but not for the long term. And so it doesn't give you any sense of long-term well-being. And I think the medicine of the future is moving toward preserving our health and really that long-term well-being with the help of people who can coach you to grow your health and keep your health. Because we're all born with health at whatever level that may be. And our bodies are really doing everything they can all the time to stay healthy. But our health really depends on the information that we put in. So it depends on things like what food you're eating, how you think, the quality of sleep that you're getting, the people that you have around you, if you're drinking water or, if you're drinking soda, it really makes a difference as to what you put into your body, the information that you give your body in order to stay well. And I see the future of healthcare as teaching people how to do the best they can with their bodies and to really tune in with their bodies so that all your health does come from within. And we tend to have lost that in this sea of medicine and hospitals and doctors being the experts, and you have the doctors being the experts on the eye or on the ear, nose, and throat or on the heart. It's all separate, when really our bodies are all one being. They're all together. And it's not just the physical, it's the mental, the emotional, all of that plays in too. So when you just focus on your little one spot, yeah, sure, maybe something's going on there, but why, and what's that related to? So I see the medicine of the future as having coaches that help us really integrate all the pieces so that we can be healthy as a whole. Health and whole come from the same root. And right now our healthcare system is fragmented. It's in all these little pieces, and a lot of people, especially those who have chronic illness or autoimmune illness, they're trying to bring all those pieces together and try to see how they all fit. And there's no one that's really helping with that. So my vision of the future is having lots and lots of coaches who can help bring that health together, like put all those pieces together for people. I have a plan to do this. I have it all mapped out, and I am excited to help coaches and individuals really bring their health together and be able to learn from each other, because another huge piece of health is community, and there's so much conflicting information out there. But if we really stay close to our community and can really build health from the ground up, we will all gain health. And as humans gain health, everyone around us is going to gain health too. So the current focus of our healthcare system is all wrong. It focuses on what's wrong, which is completely upside down, because it doesn't focus on health at all. And if it's a healthcare system, then the focus should be health. It focuses on, symptoms being wrong, whereas really symptoms are information, and there's so much good information. And often symptoms are your body doing its best to heal. I love using the example of a fever. So a fever raises your body temperature. It's when your immune system senses that a bacteria or a virus is invading and raises your body temperature to kill off that invader. And once that invader is killed off, then your body can just go back to how it should function. Our medical system always wants to take the fever away. And yes, I know fevers can sometimes get dangerously high, but really that is so rare, so rare. And most fevers, the top they get up to is like 102, maybe 104. That's not danger zone fever. That's your body taking care of itself. So the symptom is the fever. That is the body raising its temperature to kill off whatever is invading. And our medical system tends to want to take that fever away. So what happens if you take that symptom, which is, yes, uncomfortable, doesn't feel great, but when you take that symptom away, then it leaves your body open to be invaded by the bacteria and virus. And often a fever, if you get that, if you let the fever happen, may last a day, maybe 2 days maximum. But if you let that bacteria or virus invade, then you're likely to be sick for a week or 10 days, and you'll get the body aches and the runny nose and the cough and the sore throat and all of those things that come with a bacterial or viral infection. But if originally you had just let that fever happen, your body would have been fine. So many of the symptoms that we experience are actually really good for us. It's our body reacting to something that's trying to invade or throw our health off. So I love looking at symptoms And then thinking about why. Like, what does that symptom really mean? I find inflammation is a very similar symptom to fever. I mean, a fever is a type of inflammation. It's heat in the body. And inflammation gets blamed for a lot of ills in our medical system. Whereas inflammation is really just a symptom of what's going on underneath. So if you think about inflammation, like think about spraining a wrist, what happens? It gets inflamed. So it gets swollen. That's inflammation. What is that swelling doing? It's bringing fluid and nutrients to the area. It's splinting an injury. And it hurts, which is a reminder that you're injured and you shouldn't use that area of your body right now. That's brilliant. But the current medical wisdom is that you take that inflammation away. Ooh, swelling is bad. Ice it. Take anti-inflammatories. Take the aspirin or the ibuprofen to bring the swelling down. And when you do that, you take away your body's very own healing process. So that injury is more likely to become a chronic injury. And yeah, maybe the ice in the moment or the ibuprofen makes it feel better for a little while because it takes the pain away. But when you take the pain away, you're also more likely to injure it further. So inflammation is one of our body's really good symptoms. And yes, I know inflammation can become chronic, but often that inflammation becomes chronic because if you keep taking the inflammation away with the ice or the ibuprofen, then your body, as soon as that wears off, it still wants to heal. So it brings that healing power, that inflammation back, and then you take it away again, and then your body brings it back. And so it's like you're constantly fighting against your body's inner wisdom. And yes, I know some chronic illnesses are inflammation-based, but in my mind, that means that your body is still trying to heal something deep inside, and you're not giving it what it needs. Maybe it's the nutrients it needs. Maybe it's the rest that it needs. Maybe it's the confidence that it needs. And so looking at symptoms as information and why is that symptom happening, I think is one of the keys to the health coaching of the future. And our doctors are not trained to do that. I am a doctor. I'm a doctor of chiropractic, and I've also been studying holistic medicine and studying my own body that has been riddled with symptoms since I was a little kid, and the bodies of many other people that I've helped heal with chronic illnesses and autoimmune disorders, which is what I have healed myself from. I've been studying that for the past 35 years, and I did become a doctor in the process so that I could help people on a deeper level. But I've found that a lot of the doctor education that I did have, I don't really need to help people be really in touch with their bodies. And examining symptoms and looking at why they're there and what they're doing is a huge piece to recognizing what is going on with someone. Like, what is the underlying cause of those symptoms? And how can we support the body in a way that allows it to heal on its own? Because I know some people call themselves healers, but the only real healer is the self. Like, I have helped people heal. I have been the catalyst and, given them information on how to heal. But all of the actual healing came from within them. All the things I've healed, the migraines, the fibromyalgia, the IBS, all of those things, all of that healing has come from within me. And helping someone recognize what their body is working hard to do to heal, and then to support that healing process, that is the ultimate role of a healer type person, of a health coach, is to help that person turn on all their healing power so they can do the healing. Because honestly, I mentioned like the different types of specialties and stuff before. And when you have a specialty, you tend to look at everything from that lens. So I'll pick on chiropractors because I am one, but the chiropractors tend to see the subluxation as the problem, and the solution for everyone. Clearing up that subluxation is the solution for all that body's function. And yeah, clearing a subluxation is great. It improves the connection between the mind and the body and the brain and the body and all of the information that the brain and the body need to communicate. Making sure that is functioning really well, super important, and lots of things can get better. It's wonderful. But if that person is also not sleeping or not thinking that they can heal, or if that person has never gets out in the sun, so never gets any vitamin D, so their cells can't function right, then clearing the subluxation is not going to work in the long run. So there are lots of pieces to helping to rebuild someone's foundation of health. And I believe that health coaches are the people who can put all that together for people and really put the healing power back in the hands of everyone. And that is the future of healthcare. So the future of healthcare has to be based on a really strong foundation. I think anyone's health needs a strong foundation in order to thrive, just like anyone's home needs a strong foundation in order to be stable. If your foundation is not strong, if it's crooked, any of that, your doors won't open and close properly, your windows won't sit right, your insulation will probably shift and you'll be cold or too hot. So it's the same with your health. If you don't have a strong foundation, then nothing else is going to grow well from that. If you don't think you can be healthy, then none of your healing powers are going to work as well as they should. So strong foundation is so important. And that's where I see the holistic health professionals of the future, or of the now, even better, of the now, coming together to help people build that strong foundation. And then whatever modalities they use, whether it's chiropractic or acupuncture or massage or whatever it may be, it's going to work even better if it's built on top of a strong foundation. So in my mind, the foundation of each individual's health and the foundation of the healthcare system, the new one that I'm building, are the same. They start the same way, and that is with the mindset. So as I said before, the current mindset of our healthcare system is based on figuring out what's wrong. Even the preventative health measures like colonoscopies and mammograms and stuff like that, those things they're billed under preventative health, those aren't preventative. They don't prevent any illness. They look for illness that is there and try to catch it early so that there can be treatment early. And often the treatment is worse than the sickness. So anyway, there's no real foundation for well-being in our healthcare system. It's all about looking for problems, figuring out what's wrong, then treating what's wrong. And then I'm sure many of you have seen like the meme that goes around where you take a medication for your high blood pressure and then you have to take another medication because now you're peeing all the time, and then you have to take another medication because since you're peeing all the time, you're not sleeping, and so on. And it goes on, a huge list of all the medications that someone may have to take because they started with one. Any medication, it affects your health. It's a stressor to your body that your body has to figure out how to use. So any medication puts more stress on your system and is likely to cause more symptoms. And, every medication comes with a huge laundry list of side effects. Well, those aren't side effects, they're possible effects. And the effect that you're trying to get, say, lowering the blood pressure, that is also a possible effect. All of those effects are possible. Every person's physiology is different, and each medication is going to affect that physiology differently in different people. So any of those side effects are possible effects. They're just as likely as the intended effect. And one of the side effects of pretty much every medication is death. So one of the possible side effects. I mean, none of those side effects are actual effects, but they can be. They're all possible. So that symptom-based, problem-based method of healthcare, the mindset of our current healthcare system, is also the mindset of most of the people. Most people think that their health is fine until they have a symptom, and then they're just chasing that symptom, trying to get rid of it. Well, that's not true. Lots of things with our health aren't even symptom related. So if you wait till you have a symptom to address your health, to take care of your health, it's too late. Especially if then you take that symptom and just try to get rid of it. Because like I said before, symptoms are information, and they're really good information. And often they're your body doing what it can do to stay healthy. So the problem-based mindset of our current healthcare system and of our people who have been indoctrinated by our current healthcare system is one of the big problems in health as a global issue. So if we can shift our mindsets, the people's mindsets, to one of focusing on building health, building that strong foundation of health, I think this is the way to really build a new healthcare system that is based on health. Our current system, problem-based, if we keep supporting that, we're going to keep getting more problems and keep the focus on the problems and figuring out what's wrong all the time. If we can shift that focus to actually building what's right, we're going to have a lot more that's right in our own health and in our healthcare system. So this is the training that I am working on for all of our holistic health professionals and any professionals that have a mindset to build health rather than treat symptoms. So like I said before, getting rid of symptoms is really getting rid of health. I mean, yes, we want our symptoms to go away, but if we're just focusing on getting rid of that symptom, then we're not focusing on the building of the health. And the building of the health is really where vitality, longevity, happiness, and true health comes from, building the health. So the first thing we have to do to keep that foundation of health strong is really shift that mindset to one of, we all have health. We all have health within us, and we're either building it or chipping away at it with the actions that we take every single day. Those actions are things like our thoughts. Whatever we think about our health, if we think there's something wrong with us, then there's likely to be something wrong with us. If we think our bodies are doing the best they can all the time and we can keep building on that, then we're likely to keep building our health. Those actions are things like our sleep. Do we prioritize sleep and rest? Sleep and rest are a time for healing. And many people take pride in sleeping not enough. The minimum amount of sleep that a person needs is 7.5 hours a night, 7.5 hours of consecutive sleep. That's 5 cycles of 1.5 hours each. Each sleep cycle is very important to complete, and each sleep cycle is about 90 minutes. And we need 5 of those a night in order to maximize our health, to maximize all the healing that our bodies and our minds do while we're sleeping. And I've been told by coaches before that I'll never be successful unless I'm getting up at 5 in the morning. For me to get up at 5 in the morning, there's no way I would get my 7.5 hours of sleep, even if I do go to bed on time, because I wake up in the night and then I have to get back to sleep. So sleep is one of those huge foundational things. More of the foundation is just making sure you are drinking the right amount and quality of water. Hydration is not about drinking lots and lots of water. Like if you've been told to drink a gallon of water a day, no, that's not right. It really depends on what kind of water you're drinking. If you're drinking water that has chlorine and fluoride in it, then you're dehydrating yourself constantly and you're killing off your gut health. Gut health is one of those super important things for your foundation of health. And things like chlorinated, fluoridated water, and antibiotics, alcohol, processed foods, those all destroy your gut health. Without gut health, you don't have any health. Your gut health and your immune system health are inextricably linked. And obviously, you need your immune system to work to just go out into the world. So there's so many things to building the foundation of health that if you go to a regular medical doctor or hospital, those are never addressed. Did you know that medical doctors don't have any training in nutrition? As a chiropractor in my medical training there, I did have 60 hours of nutrition training. I have studied nutrition many, many, many more hours than that on my own, both before and after I graduated school. But, there's that old saying, you are what you eat. And that has a lot of meaning to it. Nutrition is so important to your health, and the doctors that people go to don't have any training in nutrition. I remember the last time I went to an MD, I was 17, so about 30 years ago, and I was having a lot of digestive issues. I was having a lot of pain with digestion and stuff like that. And after, waiting a couple of hours after my appointment time to see that doctor, she came in and poked at my belly for a minute or so and then wrote me a prescription. She didn't ask anything about my history. She didn't ask if I had ever taken antibiotics. She didn't ask what I was eating. She just wrote me a prescription. And that was one of the huge disconnects for me with the medical system, because she didn't even take into account any of the things that could be affecting my gut. She just wanted me to try a medication. And she told me, I don't know what's wrong with you. Try this medication and come back in 6 months. I did not fulfill that prescription. I was just shocked at how inept that was. And I started really looking closely at my diet and changing some things. I figured out that I was eating too many tomato products and the acidity was not good for my gut. As I look back on it too, I recognize that I took tons and tons of antibiotics as a kid, so I didn't have good gut health anyway. But to have the person who's supposed to be in charge of helping me take care of my health not even ask anything about how I'm taking care of my health, just write me a prescription. It was one of the biggest letdowns I've had. And that is a typical experience. Nothing to do with health, just about potentially getting rid of that symptom. But another key thing is medical doctors also aren't trained in medications and what they do. If you have questions about your medications, don't ask your MD, ask your pharmacist. Pharmacists are the ones trained in medications, not the MDs. They can prescribe them. Doesn't make sense to me because they really don't know much about them. And a lot of the information they get about them is from pharmaceutical representatives who are just trying to sell the drugs. So there are a lot of problems in the medical system, and they really take away from the foundation of the health of the medical system, and they really destroy the foundation of our own individual health. So there seems to be a myth out there, especially from lots of the health influencers out there on social media or whatever, that real health is complicated and that you have to, starve yourself or not have joy in your choices. And that is so far from the truth. So real health should be simple, and joy is one of the biggest pieces that you need to have in your life when it comes to health. And it's not about deprivation. It's not about, not doing what you want or eating what you want or drinking what you want, but it's about making healthy choices. And the healthier you are on the inside, the easier those choices are to make. I kind of blew someone's mind the other day talking about gut health. So your gut, it's like the center of your body. It's where all the, whenever you eat something, where you disseminate all the nutrition from that and get it to go where it needs to go and get rid of toxins and all the stuff. The gut is super important in that. It's where your immune system is based. Gut health is so important. And most of us don't have it, and we don't realize how many things it affects. So key things that kill off gut health. If you've ever had antibiotics, ever in your life, and you haven't done a gut rebuild after, then you likely have terrible gut health. Drinking alcohol. Alcohol is an antibacterial, so it kills off your gut. Same with chlorinated, fluoridated water. Chlorine is an antibacterial also, so that kills your gut health. Fluoride, I'm not exactly sure what it does to your gut, but I know it's a neurotoxin, so, gut health, brain health, they're both really important. And then junk food just feeds yucky bacteria in your gut. And your gut health doesn't just affect your digestion, it affects everything. It affects your emotional well-being. I have helped so many people with depression and anxiety clear that by just addressing their gut health. So gut health is the basis for so many things. And, a lot of people have been told that in order to heal their gut, they have to cut out gluten and dairy and sugar and soy and on and on and on and on and on. If anyone tells you have to cut out a bunch of stuff from their diet, find someone else to talk to. So the key with gut health is getting rid of the things that destroy it and also rebuilding it. And many people have the misconception that probiotics alone will rebuild a gut, and that is not the case. The first key to that, after getting rid of the antibiotics, alcohol, chlorinated water, and junk food, is getting rid of all the yucky bacteria that's in there. And this is interesting, and sometimes it can happen at the same time as the getting rid of the junk food. The other things need to happen before this, but hopefully aren't as hard to do. Junk food and sugar can be extremely hard to let go of, but part of the reason for that is that if you don't have good gut health, if you have junky bacteria in your gut, they're going to crave junky food. So humans, we're mostly bacteria, and we're mostly just driven by whatever the bacteria in our bodies need. So if you're craving a lot of junk food, it's likely that your gut health is terrible. And so in order to stop craving the junk food, and this is where I talk about not having to deprive yourself to be healthy, if you're craving junk food, then you already have lost some health. And so in order to fix that, so the first thing you do is a gut reset. Now, I use a specific protocol for this that has some supplements, just a couple. I don't believe in taking a lot of supplements, but a couple for a short amount of time, clearing out all the junky bacteria and replacing it with really good bacteria. Now, my protocol takes about 70 days, and this is something that I teach to all the holistic health professionals that come into my program. And this is super important because if you just take probiotics, even if they're really high quality probiotics, which are hard to find in the store, then the bacteria that are already in your gut already are established there. And if they're junky, if you're craving sugar and junk food and all kinds of gross stuff, then they are not going to let the probiotics in because they're already established. So the probiotics and the old bacteria are going to kind of butt heads and go to war a bit. So lots of times I've had people report when they start taking probiotics, they actually feel worse. Their stomach is upset, they feel tired, they feel moody, all of that stuff. It's because there's that fight going on between the established bacteria and the new good bacteria. So the key is clearing out all the established stuff first so that you can replace it with good stuff. And when this happens, it's a bit of a miraculous process because as those junky bacteria clear out, people report that they don't crave junk food as much anymore. It's just without those bacteria that are craving it, because it's not actually the person craving the junk food. It's the bacteria craving the junk food. So when you clear that out and then reset it with good stuff, crave better food. And when you have good bacteria in your gut, not only do you crave better food, so you get better nutrition and you can break it down better, so those nutrients go where they need to go and you're getting the nutrients that you need. But it affects everything. It doesn't just affect how your belly feels. It affects how your mood is. So that's where lots of people, their depression and anxiety clear up. It affects how much healing you're doing on the inside. So remember I talked about inflammation earlier. If you're giving your body the right nutrients and you have the right bacteria in there to break down those nutrients and put them where they need to go, then your body starts to heal those things that have been trying to heal for a long time but haven't been able to, so the inflammation has been just staying there. Inflammation takes a lot of energy, so once you start that healing process and the inflammation can do its job, heal things and go away because it has all the information it needs now, then you gain all that energy back. So the inflammation was taking all this energy to do the healing. Once that healing's done, then you get that energy. So I've had people report their pain going away, their energy coming back, their anxiety and depression going away, their mood just being uplifted, so much more joy in their lives, their cravings go away, all from just doing a simple gut reset. So the gut is one of the keys to building that foundation of health. And it's also one of the things that our current medical system tends to just destroy from early on. Ear infections are one of the common symptoms in kids and babies, really little ones. And immediately they're given antibiotics for those, even though the American Academy of Pediatrics doesn't actually recommend antibiotics for ear infections. There's an article, you can look it up. But it's the simple fix. So lots of babies are given antibiotics when they're just like a couple months old. So right from then, their gut health is starting to be destroyed. And so then they never have the health that they should have had because their parents don't know them any differently. They don't know them with a healthy gut. And so they don't really think anything's really wrong. And so things that happen like skin issues like eczema and allergies and asthma and all of those things, those are all related to gut health. Those start to just become normal, part of normal life. And that can all be traced back to that gut health being destroyed at a young age. So very important to maintain the gut health that you have. And if you have done any of the things like taken antibiotics, or if your children have, or if chlorinated water is a regular part of your life, or if you drink alcohol, all of these things are going to destroy the gut health. So even if you have rebuilt it and then you've done those things after, it's going to take another rebuild. Gut health is one of those things that you have to really nurture and take care of. And unfortunately, how our society is set up, it's not really set up to nurture or take care of gut health. Even going out to eat can be really hard because most things are cooked in seed oils. Seed oils are extremely hard to digest and can really gum up the system. Most baked goods are made with enriched flour, Enriched flour is sprayed with folic acid. And I know you think you need folic acid, but it's folate that you need, not folic acid. Folic acid is impossible to digest. And so again, it gums up the system and makes your gut not function like it should. So we're really not set up for healthy guts, and you have to be really kind of vigilant to keep your gut healthy. But once you have that gut health, your immune system works better, your moods are better, your sleep is better, everything works better, and cravings go away because those bacteria are replaced with good bacteria that crave good, nutritious food. So gut health is a huge, poor gut health is an epidemic right now. And I believe it's a reason that people, that lots of medications are prescribed, that the root of the problem is actually the poor gut health. And that can lead to so many symptoms that get treated with medications, which then just put more strain on the nervous system and keep people from functioning like they should. So if you have any symptoms of poor gut health, if you have sugar cravings, junk food cravings, fatigue, anxiety, depression, poor immune function, autoimmune illness, chronic pain, all of these are symptoms of poor gut health. Oh yeah, also stuff like IBS and any of those gut symptoms, gut pain when you eat, all of those things. Of course, it's a little more directly related to gut, but those are symptoms of poor gut health too. If any of those things are happening, look into a gut reset. I can help you with that. If you have a holistic health professional that doesn't know about gut health, connect him or her with me, and I will teach them how to fix the gut health for all their clients, and they will get better results for everyone once their gut health is healed. Gut health is such a big key. Please think about your gut and fix it. It can solve so many problems. So I find another huge destroyer of our foundation of health is thinking that nature is bad for us. So, our cells, we're made up of a whole bunch of cells, and they need to function at their best all the time in order for us to function well. Cellular health, cellular function is key to us being able to function. If our cells aren't healthy, we're not healthy. One of the key things for cell health is vitamin D. And I feel like it's kind of become the rage lately to take vitamin D supplements, and those can be okay. There aren't any, I think, that are really great, but they can be helpful, especially if you're super low in vitamin D. How do you even know if you're super low in vitamin D? Well, some of the symptoms are poor immune function, fatigue, anxiety, depression, kind of just lethargy, not wanting to do anything, and getting sick all the time. So a blood test can be done to determine your vitamin D. Unfortunately, most people who read blood work, like if you're getting it read by an MD, they will just look for the normal range. And the normal range for vitamin D is usually either 10 to 100 or 30 to 100. These are huge ranges for one, and they are not functional ranges. So functional ranges are what I look at when I read blood work, and they're what I teach people to read when they read blood work. And functional ranges are those ranges where people actually function well. The functional range for vitamin D is 80 to 100. Most people don't feel good until their vitamin D is up to 80. Most people's vitamin D is not that high. It is one of the key things to look at if you're having any sort of chronic illness. And for health professionals, if you're not looking at vitamin D, you're missing a huge piece of the picture. Anything that you do as a modality is going to work better if someone's vitamin D is there. And it's not going to work well at all if vitamin D is not high enough, because that means the cells themselves can't function. If the cells aren't functioning as well as they can, no medication is going to work as well as it should. No chiropractic adjustment, no acupuncture treatment. None of these things are going to work as well as they could work if the vitamin D was up at a functional level. So I said earlier that supplements aren't that great for your vitamin D levels. And I say that because typically we don't get vitamin D through our digestive systems. We get vitamin D through our skin. We actually make our own vitamin D. Isn't that cool? Our bodies are just amazing, all the things they do to keep us healthy and well and alive. The key thing that we need to make vitamin D is we need to get sunlight on our skin. Don't be afraid of sunlight. Sunlight is the life giver to our planet. Without sunlight, we would not have any of the life that we have. And to have sun be so demonized is just one of the biggest tragedies of our generation, couple of generations. It's one of the biggest tragedies because vitamin D is one of the best cancer preventatives out there, and we get vitamin D from the sun. We've been told for decades now that vitamin D gives us skin cancer. I'm not exactly sure where this came from. I think potentially, it came from, part of it anyway, from when people were really trying to get deeply tanned, like putting oil on and baking out in the sun so they could have these insane tans and all of that. That's not great. Burning yourself in the sun, that's it's a burn. It's an injury to yourself. So you don't want to get sunburned. But preventing yourself from getting any sun on your skin is potentially an even bigger injury. Because without sun on your skin, you can't live like you're supposed to live because your cells will not be functioning like they're supposed to function. So, getting sun on your skin, really important. Another one of the big problems with this is that sunscreen is so overused. Almost every sunscreen on the market is full of super toxic stuff. Yes, it prevents you from absorbing the vitamin D from the sun, getting any of the sun's rays on you. But it's also full of all kinds of chemicals, and it prevents your skin from being able to breathe. You know how thick and gross sunscreen feels? It prevents your skin from being able to secrete toxins and all of that. It's really horrible stuff. It's full of cancer-causing ingredients, and it's really keeping people sick. And we're told from the time our babies are born that they need to have sunscreen on whenever they're out in the sun. So we're poisoning our babies as we put sunscreen on them, and we're keeping them from getting the vitamin D that they need from the time they're born. And it's a huge tragedy because, without vitamin D, nothing's going to function right in your body without pretty high levels of vitamin D. Now, it's challenging sometimes because a lot of us live, including myself, in places that have not very sunny weather a lot of the time, especially through the winter. And so it can be hard to get enough vitamin D to last us. So I do think supplements are an important piece. And if someone is severely deficient in vitamin C, vitamin D, vitamin C is another good one. But if someone's severely deficient in vitamin D, then taking a supplement for a period of time can be really helpful. Most supplements you're going to get at the store are not the supplement that you want. They're not very high quality. They're not very absorbable. They probably have a lot of other junk in them. So I highly recommend, if you're a holistic practitioner, getting supplements from a very reputable source. I, as a doctor, can get into some companies where you need to have a doctorate in order to purchase. A lot of those are relaxing now a bit so that health coaches can order from them too. And especially if they have a doctor kind of overseeing things, if they're under a doctor's account, I am happy to set that up for any of the people who go through my program. But I don't recommend just taking any old vitamin D supplement because you never know the quality, the ingredients, and how effective it's going to be. I do recommend, even if you are taking a supplement, that you still get out in the sun as much as you can. And even filtered sunlight, like even if it's filtered through clouds, you're getting out there, getting your skin exposed to that light is going to help some. Get your vitamin D checked. If you have any symptoms that are concerning, or if you are someone who's taking care of clients and you're not seeing the results that you think you should see, or even better, as part of your intake, get a vitamin D test done on every client, because it's one of those key things that if they're deficient, nothing you do is going to work, whether it's changing their diet or adding supplements or doing meditation work or anything. It's not going to work as well as it should if they don't have a high enough level of vitamin D. So nature is good for us. I feel like one of the big problems with our health these days is kind of this thing as we're seen as other than nature. Like nature is out there and we are in here and we're separate, and that we're bad for nature and nature is potentially bad for us. So sunlight is part of nature. We are part of nature. And if we don't get what we need from nature, we're not going to be as healthy. I think sunlight is one of the biggest things that people are missing. Another thing is earth, just getting connected with the earth. We tend to be exposed to a lot of things that have a vibration that's not really conducive to our health. It's not something we evolved with, like computers and phones and LED lights and fluorescent lights and cars and planes and electricity. All of these things are not things that humans evolved with. And I know when I'm around them too much, I feel like it kind of revs up my system. It's almost like a caffeine feeling where my brain can't slow down and I feel a little zoned out. One of the best things that can do as an antidote to this is to get your feet into the dirt, get out into the fresh air, be on the mountain or on the sand without your phone, without any electronics on you, and just really revel in that feeling of being close to the earth, touching the earth. Earth and sun are two of the most important things for our health, and we tend to be very separated and more separated from them all the time. As even in the past 4 years, as stuff like Zoom has gotten more and more important in our lives, we're not going out to meet with people in person. We're just meeting with them on Zoom a lot of the time, and it's great. It broadens the people that we can connect with, but it also takes us out of interacting with people and interacting with the world in a lot of ways. Another piece of nature that is super important to be exposed to is other people. We're not meant to live alone. And not just for emotional reasons. You've probably seen the statistics about how, like, the longer a hug is, especially if it's a minimum of 20 seconds, the more oxytocin we produce, which is the love and connection and calming hormone. Very important for us to have in our lives. But on another level, being exposed to other people is really good for our immune systems. I know since COVID, when we were all isolated for that year or more, wearing masks when we went out, not seeing people, not hugging people, since we've gotten back out and around each other, a lot of people have complained about how they get sick so easily now. Well, that's because we basically turned off our immune systems for a year. So the immune system is like a muscle. If you don't use a muscle, it's going to atrophy. And the immune system is the same way. So any exposure to other people, to those bacteria and viruses that are out there all the time, those activate our immune system and tell it that it needs to work. And when we went without that exposure for so long, our immune systems were like, oh, hey, life is easy. We don't need to do anything. And they kind of went to sleep. And so now people are getting sicker and sicker because they haven't used their immune systems for a while. So getting exposure to other people is one of the big ways that our immune systems get activated. And it's one of the natural ways that our immune systems get activated. It's super important. So the oxytocin from the hugs and the immune system activation from the hugs, two key things to our natural way of being healthy and to building our foundation of health. So um, get out there, get the sun on your skin, get your feet in the dirt, get some good hugs. It's all going to boost the health in the long run. And if you're working with people trying to help them stay healthy, these are some of the simple shifts that you can coach someone into making in their lives that seem small but have huge results and are things that without them, nothing else that you coach them to do is going to work as well as it should. So do that. Tell your people to hug more and revel in the sun more, revel in the earth, get outside. Not to mention fresh air, of course. Breathing is super important. I'll get into that in another session.